Today, I want to talk about something very important health marker that is often missed in your regular health checkup and could be the root cause of many chronic diseases like diabetes, hypertension, heart disease, and kidney disease. And that is visceral fat. So, what is visceral fat? Let's understand this in a very simple way. Our body is made up of three components: muscle, bone, and fat. The fat again can be divided into two types: subcutaneous fat, the fat which lies under your skin; visceral fat, the fat that surrounds your organs like liver, kidney, even heart, pancreas. So, this visceral fat we call it as a belly fat. So, fat is not just a storage tissue, it is actually a metabolic organ. So, in small amounts, it is protective. It produces a hormone called adiponectin. That is the key and important, which is highly anti inflammatory and which helps in healing and supports metabolism. So, this fat at a lower level, it secretes an adiponectin, but there is a tipping point. The fat that increases beyond a certain level, especially visceral fat, it becomes inflammatory and toxic. This fat, which sits around your organ, like liver, which causes fatty liver, around pancreas, it can drown the pancreas and decrease the insulin production, and also can cause the diabetes. Around the fat depositing around the heart can cause cardiac disease. Even though there is a fat deposition in the muscle which is not visceral fat could be the cause of muscle deposition, fat deposition in muscle, which can cause loss of strength and loss of bulk, which is called as sarcopenia. Fat around the kidneys can cause kidney disease. So this is not just fat, this becomes a disease driving organ. But not all obese people are unhealthy, not all lean people are healthy. So then how do we decide when fat becomes unhealthy? So the fat which produces highly anti-inflammatory molecule called adiponectin, even visceral fat, becomes an unhealthy fat at certain point of time. This brings us to a very powerful concept called personal fat threshold. So this is why even in lean people we see diseases because of this visceral fat, and even in obese people we don't see much of disease even though there is a high amount of fat accumulation. So let's understand this concept, personal fat threshold. So what is it exactly? Each person has a limit of fat storage. It is a point beyond which this visceral fats becomes harmful is called as a personal fat threshold, and which is very personal from person to person. This depends on genetics, lifestyle, diet, and environment. So below this personal fat threshold, fat is safe. Above this threshold, the fat becomes highly inflammatory. And this is the point where blood marker starts to change. This is the point where your insulin resistance starts to begin. Your inflammation starts to increase. Inflammation is very closely related to your visceral fat. So remember, this is not how much fat you have, it is about when this fat becomes harmful. This is very important for us, especially for Indians, because we look thin outside, but we carry fat inside. This can also be called as a TOFI, thin outside, fat inside. So even at a normal BMI, we may already be above our personal fat threshold. That is the key point in understanding in every chronic disease. So now the question is, how do we measure this? How do we measure this personal fat threshold? There is no single method. I usually follow a 3-point strategy because this is a relatively new concept. Personal fat threshold is a relatively new concept. So first important thing is assess your waist measurement, which is simple, which can be done at home, but not fully reliable. The most accurate way is body composition analysis through DEXA scan, which is a gold standard method. But not all DEXA scan capable of assessing visceral fat threshold. There are some advanced DEXA scan which can assess your bone mass, muscle mass, and fat threshold, and also the fat percentage, especially the visceral fat percentage. So this needs to be correlated with your blood markers. Second important thing is, once you assess, it needs to be correlated with your blood markers. So blood markers like inflammatory markers, insulin, lipid, your HbA1c, your fasting glucose, your postprandial glucose, all this gives insight whether this visceral fat is correlating with your blood markers. This will tell us whether this fat is already causing damage, or we can assess their trending. What is their trend levels? Finally, you have to correlate with your clinical symptoms like energy levels, sleep, fatigue, metabolic signs, because these are all closely correlate with your fat behavior, the visceral fat and the fat behavior, that is your personal fat threshold. Now comes the most practical point: how do we address this visceral fat and how do we manage our personal fat threshold? Basically, you have to assess, then you have to understand the behavior of your fat inside our body, visceral fat that we have seen how to measure it. The assessment, the most important thing in management is, first thing is nutrition. So weight loss, any amount of weight loss by any method which reduces your body weight is going to reduce your visceral fat. But the key and most important thing is, it is not about the simple weight loss, it is about the fat loss with muscle preservation. Any diet which causes muscle loss can later on causes severe, it can worsen your metabolic dysfunction at the later stage. Thereby again you start accumulating your fat behavior changes, visceral fat increases. General rule, if you have exceeded your personal fat threshold, in general rule, you may need to reduce at least 10 to 15% of your weight loss. Even in lean people, we see that those who have exceeded personal fat threshold, they might have to reduce at least 5 to 10 kilograms of weight. So that is the most interesting part. So BMI will not give you a correct picture, because BMI is based on your height. It is not based on your fat behavior. Personal fat threshold is entirely clinical and behaves how your fat behaves inside your body. So this must be personalized. And second important thing is exercise. This is the most powerful way of reducing your visceral fat apart from your diet. So you cannot overdo your exercise with poor nutrition. So exercise is important, but not all exercise is equal in reducing your visceral fat. The most effective exercise is HIIT, high intensity interval training. But it is important that not everyone are suitable to do this exercise. So you have to gradually build up your endurance capacity, which we will discuss on this, especially in other videos. But HIIT is the most powerful way of reducing your visceral fat. But before you jump on to do any amount of exercise, especially people with high visceral fat, I always check them for their cardiac risk markers, cardiac risk assessment. Especially what I use in my clinic is cardiopulmonary exercise testing. That's very, very useful and very, very important, because it helps us to rule out the stress ECG, cardiac risks, helps us to prescribe safe exercise levels. That is very important for every heart zones. We can identify your heart zones, at what heart zones you're going to be safe, and then slowly helps us to build up to HIIT level. So which is the most effective way to reduce your visceral fat. And third important thing is therapeutic intervention, that is your medications. So any medications currently available which reduces your weight is going to reduce your visceral fat. The common and basic, commonly used, the most popular medications now available is GLP-1s, which effectively reduces, which is seen to reduce visceral fat. And also some diabetic medications like metformin also reduces your visceral fat. But the important thing is, it should be always combined with your lifestyle management, nutrition, exercise, because here we are targeting your metabolic function. Just not only reducing your weight, improve your metabolic function. So metabolic loss can occur with this medication if it is not followed with lifestyle practices. And fourth, the most important and most underrated thing in visceral fat is stress management. Stress directly increases cortisol levels. It can cause cortisol adrenaline dysfunction, which has a direct impact on visceral fat. Poor stress management, in spite of following other lifestyle practices like exercise, nutrition, even medication, can lead to suboptimal results. And in fact, it can even worsen the visceral fat. So stress management is very, very important and key in reducing your visceral fat, and also the impact of chronic diseases like blood pressure, hypertension, cardiac diseases, etc. So, in summary, whenever you do your health checkup, you have to assess your body composition. That is the key in understanding your chronic diseases. Most importantly, assess your fat distribution, that is visceral fat, and how this fat behaves in your body. That is your personal fat threshold. So once you're able to understand and assess clinically with your blood markers, it will be easy to manage your chronic diseases. So don't just check your weight, understand your body composition, understand your visceral fat, understand your personal fat threshold. Because health is not about looking normal, it is about being functionally optimal. That is the key. It is more personal to you. If you want to have created a simple way to you to check your personal fat risk at home, you can download it from the link below which I provided and start understanding your personal fat threshold and visceral fat.